Hi everybody. So today we'll be studying the guideline for anemia. So anemia guideline again given by our country, by Government of India in fact, and it is called as Anemia Mukt Bharat. 2018 की guideline है. It's not a very new guideline, but it is one of the largest guideline, one of the largest intensified program that has been run in the country. इसका दूसरा नाम है Intensified National Iron Plus Initiative. So the another name इज इंटेंसिफाइड नेशनल आयरन प्लस इनिशिएटिव INIPI. इससे पहले वाला था नेशनल आयरन प्लस इनिशिएटिव. दिस इज इंटेंसिफाइड नेशनल आयरन प्लस इनिशिएटिव. ठीक. सो दिस इज द सेम एज अनीमिया मुक्त भारत. तो लेट्स गो थ्रू द रिव्यू फटाफट. व्हाट इज रिटन इन द गाइडलाइन? द पर्पज इज, इस पूरे वीडियो का पर्पज है that you get a overview of what is there in the guideline. If anything catches your attention, if anything you want to know into the detail, I would love if you could go to the guideline directly on Google and read the whole guideline. If you are a resident, you should preferably do that. If you are a student of MBBS graduate, you are a final year student, then the video is sufficient for knowing what is written in the guideline and what could be the probable questions that can be asked. Okay, so let's see what guideline gives about diagnosing anemia. आपको पता होगा अनीमिया मुक्त भारत हैज डिफाइंड इट्स इनिशिएटिव इनटू 6x6x6, जिसमें देयर आर 6 टारगेट्स के 6 बेनिफिशियरीज. तो these 6 beneficiaries are these. And how do we diagnose anemia in them? Not men, up till pregnant women. How do we diagnose anemia in them? In children, anemia is called if it is less than 11. Anything less than 11 is anemia in children up till 5 years of age. 5 years के बाद 11.5. Let's focus on more important that can be asked, that is pregnant women. Pregnant women में anemia, we call it anemia when the iron is below, hemoglobin is below 11. Non-pregnant women में ये value होती है 12. And men में we call it anemia when it is below 13. ठीक है, सो ऐसे याद रख सकते हैं, प्रेग्नेंट वुमेन में बिलो 11 इज अनीमिया, नॉन प्रेग्नेंट में बिलो 12, एंड इन मेन बिलो 13 इज अनीमिया. ठीक है. नाउ इन प्रेगनेंसी लेस देन 7 इज द सिवियर फॉर्म. ठीक है, और अगर वो प्रेग्नेंट नहीं है देन लेस देन 8 is the severe form of anemia. So less than 8 in a non-pregnant person is a severe form of anemia. ये हुआ diagnosis. Now this chart you must have frequently seen. 6 beneficiaries. What are the 6 beneficiaries? Children up till 5 years of age. From 6 months to 5 years of age is group 1. Then children from 5 to 10 years of age. Then adolescents. Adolescents कौन सी एज ग्रुप को कहते हैं? 10 to 20 years adolescents, girls and boys. ठीक है. Then comes the pregnant woman, and then comes the reproductive age woman. These are the and the lactating women. So these are the 6 beneficiaries that are involved, that are benefited by this program. And it is such a huge program that it is covering over 450 million people. आपको अंदाजा, you will not get it how much it is. It is the 50% of our population. So 50% of our population is being covered in this program. To these 6 beneficiaries, what we give is the 6 interventions. Let's see what are the 6 interventions. पता होगा, let's revise in little detail. पहला है prophylactic iron folic acid supplementation. We'll read what is the prophylactic IFA for all 6 beneficiaries. Deworming सारे 6 beneficiaries में क्या dosage है और कितना frequently करते हैं. ठीक है. फिर intensified year round change. Intensified year round change में सिर्फ delayed cord की cutting नहीं आता है. There are other things also and we will read them. Testing and treating the anemia. तो पहले है तो आपने prophylaxis दिया. You gave prophylactic iron folic acid. बहुत ज़्यादा ब्लड लॉस ना हो, सो यू डिड डीवर्मिंग एंड यू चेंज्ड योर ओन बिहेवियर ऑल्सो. देन यू टेस्टेड एंड ट्रीटेड द अनीमिया. एक और चीज आपने की, यू फोर्टिफाइड द फूड सो दैट द पीपल कैन गेट एक्स्ट्रा आयरन. लास्ट चीज क्या थी? लास्ट चीज वाज फोकसिंग ऑन नॉन न्यूट्रिशनल कॉजेज ऑफ अनीमिया लाइक मलेरिया, hemoglobinopathies and fluorosis in endemic areas. So these are the 6 interventions. क्या किया आपने? प्रोफाइलेक्सिस दिया. कैसे? आयरन फोलिक एसिड सप्लीमेंटेशन से, डीवर्मिंग से, फूड फोर्टिफिकेशन से और इंटेंसिफाइड ईयर राउंड चेंज से. फिर प्रोफाइलेक्सिस हो गया, फिर आपने ट्रीटमेंट किया, देन यू टेस्टेड एंड ट्रीटेड फॉर अनीमिया. एंड लास्ट इज लेट्स फोकस ऑन सम नॉन न्यूट्रिशनल कॉजेज ऑल्सो विच कैन बी देयर इन एंडेमिक प्लेसेस. ठीक है, ये है 6 इंटरवेंशंस. नाउ सर्विस डिलीवरी. अब एक एक को डिलीवर कैसे करते हैं, लेट्स सी दैट. लेट्स फर्स्ट सी दी आयरन फोलिक एसिड सप्लीमेंटेशन. व्हाट इज द सप्लीमेंटेशन गिवन इन ऑल एज ग्रुप? चिल्ड्रन 6 months to 5 years, इन चिल्ड्रन को देते हैं सिरप. And the syrup has to be given by the ASHA worker first and then it has to be, then Asha worker train the mother to give this syrup bi-weekly. So ये pink syrup is given bi-weekly to the baby by the mother herself. She get a syrup and she get a dispenser also. So Asha worker at home will teach the mother how to give it bi-weekly. This is the syrup for children up till 5 years. फिर बड़े बच्चों में आते हैं up till 5 to 10 years. Now they can take tablets. So they take pink tablets. So pink tablets having 45 milligram iron and 400 mcg folic acid is given to these children once a week. और ये कहाँ पे दिया जाता है? इसे कहते हैं सर्विस डिलीवरी. वेयर इट इज टू बी गिवन? इट इज टू बी गिवन इन द schools, both in the government and private schools. Weekly iron is given to the students. Those who don't go to the school, the ASHA worker will ensure delivering the iron to their home. ठीक है? Adolescents, again, adolescents को iron दिया जाता है in their school and the frequency is weekly. Their tablet is blue color tablet. कंटेंट सेम है जो हम प्रेग्नेंट वुमेन को देते हैं. सो एडोलेसेंट में क्या कंटेंट है? 60 मिलीग्राम आयरन, 500 mcg फोलिक एसिड, बट इट इज गिवन वीकली इन द स्कूल. आफ्टर मिड डे मील स्कूल में देते हैं बाय द टीचर्स. Pregnant women को obviously at every ANC care she has to be given iron folic acid red tablet and it is taken daily. Daily for how long? For 180 days. And it has to be started after the first trimester. And it is continued in the lactation also till 180 days. So इन categories में ये iron दिया जाता है बच्चों को and adolescents को and pregnant women को, and this is how we provide it. ठीक है? So this is the prophylaxis of iron folic acid to each category. Now comes the deworming. Deworming कैसे करते हैं? So deworming की tablet है albendazole. For all of them it is albendazole. For all of them the dose is 400 milligram. बच्चों में, स्कूल एडोलेसेंट्स में एंड वुमेन ऑफ रिप्रोडक्टिव एज में सब में बाई एनुअल देते हैं, यानी कि ट्वाइस इन अ ईयर. बाई एनुअली स्कूल्स में डिस्ट्रीब्यूट होती है. आई थिंक इट इज 10th जनवरी एंड 10th अगस्त जब दिया जाता है, अप्रोक्सीमेटली दैट इज द डेट. और ये बाई एनुअली स्कूल्स में एंड रिप्रोडक्टिव एज वुमेन को देते हैं. द डोज इज 400 मिलीग्राम. डोज फॉर चिल्ड्रन विच आर लेस देन 2 years, सिर्फ 2 साल से छोटे बच्चों के लिए डोज हाफ है. So when your child is less than 2 years, then the dose is half. What about pregnant women? Pregnant women को यही dose देते हैं, but single in second trimester. So single dose in second trimester is given to the pregnant woman and albendazole is given. बाकी सबको biannually देते हैं. ठीक है? This is about your deworming. Intensified year-round change. What change we can bring into our practice so that patient doesn't develop anemia? क्या कर सकते हैं? We ensure compliance. हमने दे तो दिया. Whether the kids are taking it or not, whether the pregnant woman is taking it or not. So ensure compliance first to these tablets. Adequate age-appropriate complementary food. So we have to ensure that the midday meal given to the children has age-appropriate complementary food has to be given, which is nutrient enriched. Next, what do we give next? Food fortification. So Indian government has said everywhere in government schools and hospitals where staple diet is being provided, it has to be fortified. तो क्या क्या diets हैं जो आपको fortify करने हैं? You have to fortify the rice and wheat with iron, folic acid and vitamin B12. This fortified diet has to be used in government schools where the food is being provided by the government. फिर you have to fortify the salt. The salt is double fortified. इसे कहते हैं double fortified because it has iodine, ये तो हमें मालूम ही है, plus it has iron. Then the another thing that is fortified is vegetable oil. The vegetable oil is fortified with vitamin A and D. So it has to be fortified with vitamin A and D. So all this fortified food has to be provided in the government aided schools and hospitals. Next, delayed cord clamping. So delayed cord clamping is another intensified year-round change. That इसमें guideline has written that cord clamping should not be done before 3 minutes. ठीक है, as per this guideline. And then one thing is also mentioned: immediate starting, early initiation of breastfeeding. And early initiation of breastfeeding guideline has written is within 1 hour. So early initiation of breastfeeding is also an intensified year-round change that has to be done within 1 hour. ठीक है? So we got it. We got the iron folic acid supplementation, deworming, who do it and how much is the dose. Then what is the year-round change. अब आते हैं testing and treating of anemia. For testing, they have said everyone should use a digital hemoglobinometer. So this is being provided at various centers. The digital hemoglobinometer should be used for testing of anemia. And let's talk about all the target groups. For testing for anemia, in cases of children from 5 years to 10 years, and also adolescents, in them where the anemia risk is high, the digital testing is done yearly. So their yearly testing has to be done as per the guideline. What about children which are less than 5 years of age? For them, we call it the opportunistic testing. Opportunistic means in case they develop some illness, they are coming to your center, then you test them. Because they are young children, unme we don't do yearly testing. But in adolescents and children more than 5 years, we do yearly testing for anemia. Now let's focus on प्रेग्नेंट वुमेन, जिस पे ज्यादा क्वेश्चन आ सकते हैं. फर्स्ट ऑफ ऑल, प्रेग्नेंट वुमेन की टेस्टिंग कितना फ्रीक्वेंटली करनी है? व्हाट वी यूज्ड टू डू इज फर्स्ट विजिट पे कर लो और 28 पे कर लो. नहीं, you have digital hemoglobinometer. You can just diagnose it there with using a blood spot and check it. So it is done at every ANC contact. This is what is written in the guideline. It is done at every antenatal contact. Now let's see how to treat it. If it is mild anemia means 10 to 11. You just, इतनी बड़ी गाइडलाइन नहीं पढ़नी, just focus on what I am telling you. 2 tablets of iron folic acid. आपको 2 tablets देने हैं. It can be given at any level. It means ASHA worker can also give it. You don't need to refer her to a district center. It can be given at any level. 2 tablets देनी होती है. Parenteral iron तब देना है when she is in late gestation. That's it. When she is in late gestation and you are doubting the compliance. तब एक बार आपने आयरन फोलिक एसिड दिया, रीचेक कब करते हैं? आफ्टर 1 मंथ. फोकस हियर. After 1 month. Even after 1 month, when hemoglobin is less than 1, when the rise is less than 1, then you refer her. That is an indication of starting IV iron, and then you refer her if hemoglobin rise is less than 1. Moderate anemia में exactly same करते हैं. You give 2 tablets and recheck up them after 1 month, and there should be a rise of 1 gram per DL in 1 month. Severe anemia. Severe anemia is less than 5. Management of severe anemia is done by the medical officer at PHC, CHC or a district hospital. It is not done by ASHA worker, not done at a home level. ठीक है? We will discuss about कौन से 2 compounds available. Now there are only 2 compounds which are allowed for IV iron. What you have to give is IV iron. But in 3rd trimester, you need immediate hospitalization and blood transfusion. सो वैसे सिवियर अनीमिया में एट एनी जेस्टेशन यू गिव आईवी आयरन, बट अगर वो लेट जेस्टेशन में आती है, देयर इज रिस्क ऑफ हार्ट फेलियर, यू गिव हर ब्लड ट्रांसफ्यूजन. एंड लेस देन 5, सिवियरली एनीमिक वुमेन लेस देन 5, blood transfusion immediately. You have to transfuse blood if the hemoglobin is less than 5. ठीक है? This is what is written in the guideline. ठीक है? Okay. Now, injectable iron. What they have mentioned about injectable iron? There are only 2 sources of injectable iron. That is iron sucrose and iron carboxymaltose, FCM. That's it. Only 2. And they are given IV. IM iron now are obsolete. They are nowhere mentioned in the guidelines. Guidelines mention only iron sucrose and iron FCM. Now let's see the first indications of IV iron. We know when the anemia is less than 7. When anemia is severe, less than 7, you give IV iron. ठीक है? And but when it is less than 5, then you give blood transfusion. So pregnant women में less than 7 पे you give IV iron, but lactating women में at less than 8 you give IV iron. So lactating women का threshold for IV iron is 8. ठीक है? आपको याद होगा when we were reading anemia अभी on the first slide, severe anemia in a non-pregnant woman is less than 8. Less than 8 is severe. ठीक है? Other indications for IV iron, if she's not tolerating oral iron, she's not compliant, or hemoglobin is not improving, that is 1 gram per DL in 1 month. If that much improvement is not seen, you give IV iron. Always rule out contraindications. Focus only on important one. Liver disorders. thalassemia, sickle cell anemia, hemolytic disease, and fever. In all acute illness and fever, you don't give IV iron. ठीक है? What is the difference? Both of them are very efficient, but guideline एक बहुत अच्छा सा difference दिया है that when there is carboxymaltose, there are two compounds, iron sucrose and carboxymaltose. Iron carboxymaltose has more rapid replenishment, and also it is seen for a faster and hemoglobin rise, and it is more sustainable. So FCM compared to sucrose gives a more sustainable rise in hemoglobin and a rapid rise in hemoglobin. The rise in hemoglobin is more with FCM. Also, FCM की antigenicity बहुत कम है. It means reaction risk is very less. Also, good thing about FCM is prefer दोनों करते हैं. ऐसा नहीं है. There is no more preference to anyone. But yes, we prefer those, both of them in pregnancy. But FCM is being considered slowly as a better compound. आप सुक्रोज की एक बार में 200 मिलीग्राम डोज दे सकते हो. मैक्सिमम यू कैन गिव 600 मिलीग्राम इन 1 वीक. FCM आप सिंगल सिटिंग में 1 ग्राम दे सकते हो. So you calculate the dose by Ganzoni formula as written in the guideline itself. कि Ganzoni formula से you calculate the dose and you can give 1 gram of FCM in 1 sitting. देते कैसे? दोनों आयरन को 0.9% सलाइन में देते हैं. यू स्टार्ट एट द डोज ऑफ 20 to 30 ड्रॉप्स पर मिनट. दोनों को 20 to 30 ड्रॉप्स पर मिनट में स्टार्ट करते हैं. स्लो स्टार्ट करते हैं. एंड वेंस यू सी देयर इज नो रिएक्शन, आफ्टर 5 minutes you increase the dose in both of them. You increase the dose because now there has been no reaction. So all this is something which is covered in guideline. कब फूड फोर्टिफिकेशन में क्या करना है, व्हाट इज इंटेंसिफाइड रियर राउंड चेंज, व्हाट इज द डेफिनेशन ऑफ अनीमिया, हाउ टू गिव आयरन एंड हु विल गिव आयरन, डीवर्मिंग की क्या डोसेज है, एंड हाउ टू ट्रीट अनीमिया.